All right, we're going to go ahead and get started. Welcome everyone to the TargetCool and Resilielle Exosome webinar. Super excited to have you guys here today to go over these amazing new technologies and share with you a bunch of information and hopefully educate you as well at the same time. Um, Combining TargetCool and Resilielle, we're really trying to show you a really unique, cool, needleless, pain-free way to deliver your exosomes. Next slide, please. So I want to make some introductions and kind of go over our agenda today. Really excited to have two esteemed people from the aesthetics industry on the call with us today. First being Dr. Michael Hecke. He's the Resilielle Chief Science Officer. He has an amazing background, not only just scientifically, but specifically in the exosome realm and the clinical and educational uses of those products. He holds a PhD in developmental and stem cell biology. He worked at a stem cell research for nearly 25 years at this point, and he was previously a senior research scientist at Stanford University. He is currently the Chief Scientific Officer, the COO, and the Managing Director at the Crowley Center for Regenerative and Biotherapeutics, which is based in New York. And we also have an amazing nurse on the call as well, Julie Gramick. She is she has been in the industry for quite some time, several decades. She's been involved with a lot of different products and launches, has owned her own clinic, and has used not only TargetCool and Resilielle in her office, but has gotten really great results utilizing these products together. And she's going to discuss a little bit about her experience with that as well. So super excited to have both of you on this call with us. Lastly, my name is Chris Ruckel. I'm the TargetCool sales manager for the US. I have 17 plus years experience in the aesthetics industry. And we're going to go over a little bit more of the agenda today. So we really want to dive into exosomes, and there's a lot of gray area in the market, a lot of buzz about exosomes, but also a lot of misinformation out there. And so really excited again to have Dr. Hecke on to not only tell you, what is an exosome, why are they so popular right now, and then what is the difference? Are all exosomes the same, or is there differences between those? We're also going to do a TargetCool product overview so that you can see what that device looks like as well. And we're going to be also utilizing Julie. She's going to be combining the TargetCool and Resilielle and showing you how to put that into your practice. And then lastly, we're going to be offering a special promotion as well at the end. So stay tuned for that. Next slide, please. So I'm going to go ahead and pass it over to Dr. Michael Hecke. He's going to go into a Resilielle and exosome product overview.
All right. Thank you so much, Chris, for the kind introduction. If we can go to the first slide. Yeah, as you said, new technologies, both the TargetCool and the exosomes, although exosomes have been around a little bit, and they are definitely a buzzword. I think it's safe to say that they are the hottest topic in the field of aesthetics these days. But as you indicated, there's a lot of confusion, or it's quite amazing how little people really know about exosomes. So I hope to give you like a brief overview of what exosomes are, how they work, and what to watch out for, that you really can be sure to get a good product. And then we combine it with amazing TargetCool delivery system. So first slide, please. So exosomes are the functional fraction of what we call extracellular vesicles. These are tiny little bubbles that are secreted by virtually all cells. And among those exosomes, they range in size between 30 and 150 nanometers. They are the ones that are really interesting because they contain and provide all the bioactive biomolecules that cells need not to only communicate with each other, but also to regenerate. And it is very important to actually not only have exosomes only, so don't resort to extracellular vesicles or what's called conditioned media. They might contain exosomes, but they also contain other EVs that are, not really desired apoptotic bodies, for instance, they are rather harmful than beneficial. So you want to definitely look out for a purified, highly purified exosome product. And another thing that's very important about them is the structural integrity. I noted that at the bottom of the slide, and we'll get back to it a little bit later and why it's so important. So if you go to the next slide, please. This is a schematic overview of how it actually works. You have a host cell that secretes exosomes into the extracellular space. There's an exosome, a schematic of an exosome comprised of a biolipid outer layer that comprises the bubble. And this bubble contains all the amazing things, loads of RNAs, a variety of RNAs that comprise the instructions for a target cell to actually know what to do. And then you have functional proteins like growth factors, cytokines, and chemokines. You have lipids like ceramides, very important for the skin, enzymes and other metabolites like amino acids. And this is all needed to actually, for a target cell that takes up the exosome, to actually get all the building blocks and the information needed to reprogram and reboost and regain full functionality. If you go to the next slide, this is a schematic of what happens when you apply exosomes to the skin. So the cells, in our case, stem cells, because stem cells are the building blocks of life. So we want to use the regenerative power of stem cells to apply them to our skin. They can actually, exosomes by themselves, get relatively deep into the skin, and they are being taken up by the target cells. The exosomes fuses with the target cells, and then by a mechanism that we call content loading, they introduce all their cargo to the cell. That leads to reprogramming the cell and to angiogenesis, so the blood flow will be improved, collagen synthesis, and also regulation of inflammation, which is a common problem, inflammation, not only with disease, but also our skin's being subjected to environmental hazards like the sun or radiation and all these kinds of things. If you go to the next slide, we actually were the first one to entertain a clinical trial to investigate the effects of exosomes, and we also did like a dose response study with it. And what we found is that exosomes, potent exosomes, have a remarkable effect on the outcomes. So we have a 100-person clinical trial where we subjected our participants to 3 rounds of exosome therapy in combination with microneedling that back then. And you see we have quite some interesting results that came out, where we have an improvement of over 80%, sometimes 90 plus percent improvement, certain aspects of the cell of the skin. That was also published in the Journal of Cosmetic Dermatology. And this study was also featured in Vogue and The Cut NYC.
And Dr. Hicka, this slide really stood out to me. These percentages are amazing when you look at everything that these exosomes are able to do. It's also great. What I noticed as well is that it's able to treat all kinds of different skin conditions, right? So you have everything from pigmentation to wrinkles, anti-aging, texture, redness. So, with one product, you're able to treat all kinds of different, skin conditions, which is amazing as well. And then it's also safe for all skin types also.
It is, yeah. And it was, thank you for the comment, Chris. I mean, we were hopeful for results like this, but we're still like not surprised, but thrilled by the outcomes and that they were indeed that good. And as you said, it was across the board, no matter what the age and what the skin type was or the conditions. The editor of Vogue actually reported she had a scarring issue, acne scarring issue that she was never able to really address, and she had a remarkable improvement following this microneedling plus exosome treatment. So these results were really fantastic and just confirms what we hope exosomes could be. If you go to the next slide, there's another obvious application for exosomes, the hair restoration. These were our first 2 patients. The one on the left is the husband of our CMO in his mid-40s. He noticed thinning hair. That's the picture on top. Given his age, his hair was salt and pepper. And when you see the comparison to the figure on the bottom, that was just after one treatment of microneedling plus exosomes. You can see that the hair was visibly denser and it appeared also to be darker. And when you look at the gentleman to the right in his mid 70s, he's actually our chairman. And he wanted to see what our exosomes can do for his bald spot that he was, showing off with for the last 3 decades or so. And he noticed like ingrowing baby hair and so on. And initially he was a little bit underwhelmed, but if you look at the day 75, that was after the second, a few weeks after the second treatment, he was still focused on the center of the bald spot and so like, yeah, like obviously there's more here, but I could have done with more. But he failed to notice at first how that bald spot actually reversed in size. And both these pictures are a clear vote for or a testament to the actual rejuvenation we can achieve with exosomes. So it's not just like one of those standard buzzwords. We can actually turn back the clock. So hair gets denser and darker like it used to be. Or the bald spot, when the bald spot develops, you have like a small bald thinning hair first, then a small bald spot, and then it grows bigger and bigger. And if you apply exosomes, the same goes backwards in reverse. So we actually can turn back the clock, and we have any right to call that actual rejuvenation, and not just as a buzzword, but as a scientific fact. If you go to the next slide, another very interesting field of application with regard to skin is scars. And we have on the left an example for scar prevention, or as we have to say in the field of aesthetics, the improvement of the appearance of a scar. This was our CEO. She gave birth by C-section, and she was so curious to see how the exosomes might work in terms of scar prevention, and she entertained a half scar study on herself. And you see here within just 4 weeks, when you see on the right side, it is extremely well healed with hardly any purple. It's a very fine line, just like what you would hope to see. While on the left, without the exosomes, it's still a little bit rugged, still a little purplish. And I know from her that it's still purple today after almost 2 years. And now she is a little bit resentful with herself that she didn't treat the whole scar and not just, and not only half. On the right-hand side, you see a picture for scar reversal. That's something we wanted to try, and indeed it works. There was always a dogma that you cannot do anything about scar tissue. It turns out not to be correct. So there are mechanisms in play that can reverse a scar. On the left panel, you see a decades-old scar, and then after one treatment of microneedling plus exosomes, you see a very nice improvement of it. Next slide, please. And that is like another application or indication for which exosomes work quite well, and that is wound healing. While we typically don't talk about healing in the context of cosmetics or aesthetics, it's just an example of how powerful exosomes really are. This was a very unfortunate accident of a 5-year-old, actually the son of our CEO, who had a very unfortunate encounter with boiling hot water that poured down his shoulder. And you see the effects of it. This major part is a second-degree burn. And fortunately, she had exosomes on hand and applied them immediately and then continued to do so daily. And after 6 weeks, you see the result, or you barely see it, because there's almost no scarring or any residue of what happened to that boy. That gives you an idea of how powerful those exosomes can be, both in terms of rejuvenation, but also regeneration and healing and repair. Next slide, please. I mentioned the structure of exosomes. So here are two picture schematics. One is like On the right hand, it looks a little bit more sophisticated and scientific of roughly what an exosome might look like inside out. And then on the left, it's a little easier to understand the schematic. And the important part is this bilipid outer layer. You see it by those blue the blue outer bubble that contains everything that we want, what we want and need. And if you go to the next slide, I show you in another schematic how exosomes actually work. They approach a target cell or are homed in by a target cell, and then they fuse with the membrane of the target cell and thus introduce all their biomolecules. And these biomolecules consist of growth factors, cytokines, chemokines, lipids, metabolites, and a wide variety of RNAs, as I mentioned before. And all of these are actually used and needed for the cell to reprogram and thus regain full functionality. So only if you have an intact exosome, it can be bioactive and work that way. If you go to the next slide, this is an analysis, a electron microscopy analysis of our exosomes, and you see what an exosome actually looks like on a very powerful microscope, a nice donut shape, and this is actually a typical picture of an intact and therefore bioactive functional exosome. Below, you see a graph that's a nanoparticle analysis that we also routinely do for our exosomes. So we confirm the number and the size of the exosomes after we purified them to make sure that we only really have exosomes, that they are pure and that they correspond to the expected size. And you see that there's a nice dominant peak of around 100 nanometers, exactly the size we would expect. Contrary to that, you see in the next slide two competitive products. These are the two market leaders, and they actually sell you lyophilized exosomes. Now, lyophilization appeared to be a good idea because it extends shelf life at room temperature, but it comes at a high price. And the high price is that through the freeze drying process, you destroy the outer membrane of the exosome. That bilipid layer does not uh, uh, survive the freeze drying process. So what you end up with is destroyed exosomes. We also sometimes call them exnosomes because there are virtually no exosomes in there. You see that in those two panels for the trans-electron microscopy analysis, that you see like aggregates, clumps of whatever they might be, but you cannot find a single exosomes. And trust me, we tried to find, and we couldn't find a single one. When you look at the nanoparticle analysis corresponding to those electron microscopy pictures, you see that those peaks are randomly all over the place. There's virtually no peak at 100 nanometers where you would expect it to be, and that is what happens. So you might have heard that these competitive products also showed some benefit maybe, but this is not the same, and I'll get back to this a little bit later. If you go to the next slide, to summarize it in a schematic, what the difference is. So on the left, you see an exosome that is cryopreserved or stored in cryo storage in a freezer, and that's also how we ship them. So our exosomes will be shipped on dry ice, which can be considered a little bit of a hassle, and you want to store them in the freezer. They're quite stable, even if they thaw accidentally and they reach room temperature, they do not get destroyed by it. But that's the ideal way to store and to ship cells, exosomes, and also to use them. Fresh, cold exosomes. Conversely, you see on the right panel what happens when you lyophilize them. The membrane, the bilipid outer layer breaks up, all the content basically spills, and you might end up at best with a few residual growth factors, but it is a far cry from what it should be and what an exosome can do. If you go to the next slide, please. So this is what happens when you have individual growth factors. They also secreted by a producer cell, let's say, or from exosomal debris from a suboptimal product. And then they might actually be able to dock to a receptor of a cell and via signal transduction elicit a biological response. But to give you an idea, like a single growth factor is basically like tapping the cell surface like a doorbell and triggering a brief surface level response. Exosomes, on the other hand, they can actually enter the cell, fuse with the cell, delivering their full package of genetic instructions and biomolecules and reprogram and restore the cell's function from the inside out, making their effect deeper, longer lasting, and truly regenerative. So it's a major difference. If you go to the next slide, please. This is, a schematic to depicting the same. Here on the left-hand side in orange, you have the rather pitiful, I might say, a picture of a receptor and a biomolecule, such as an individual growth factor, and it might trigger a biological response, but it's very superficial and temporary. So if you compare that to this big exosome bubble that fuses with a target cell and introduces all their cargo and therefore all the components that you actually need, it's a major difference. And again, you might have a temporary effect. I sometimes give the analogy of a skin moisturizer. Imagine you have dry skin and you put on a moisturizer, then it looks good. But as soon as you leave the moisturizer away, you go back to your dry skin. That's what happens with signal transduction, temporary and superficial effect. If you have an exosome, it can actually reprogram the cell and fix it. So you no longer have dry skin that you have to treat in any way. So that's the difference. And this actually already sums it up. I hope I was able to give you like a brief overview of what exosomes can do, provided that you have a bioactive and fully functional exosome, how they work. And other than that, I mentioned that they can actually get into the deeper layers of the skin by themselves by the sheer virtue of their small size. So that's one thing. I also mentioned that we did a lot with microneedling plus exosomes. That was by the sheer virtue of microneedling still being considered the gold standard. But personally, I have done a few microneedlings myself on my face because I was curious and wanted to see what they can do. And it does work, but the procedure is just gruesome. I do not like it at all. First, you slather on those the numbing cream that is horrible, smells horrible, makes your face feel horrible. Then they smear it off, and then the microneedling still hurts. And it is, I think it's a rather medieval procedure. Contrary to that, we have a device like the TargetCool, completely pain-free. And I think Julie can talk more about it, or Chris presents a little bit about the TargetCool device, and then we will have a summary of what TargetCool plus exosomes can do for you. Thank you.
Yeah, so I'm going to jump in and talk about the TargetCool. First of all, I just want to let you know that we do have a question box in the upper right-hand corner, I believe, on your screen. So if you guys have questions along the way during this webinar, feel free to ask those in there, and we will get to those at the end of the webinar and make sure you get the answers that to all those questions. If you could go to the next slide, please. Yeah, so the TargetCool is a handheld class 2 medical device. It utilizes CO2 gas to push and deliver solutions directly into the skin. If you could go to the next slide. So this is a brief animation video showing how the TargetCool actually works. You're going to see that it sprays solution directly onto the skin, so we're actually not even touching the patient's skin. But what it's doing, it's creating these mini ice microneedling channels. We like to call it ice needling. And it's pushing those into the skin and delivering the solution deep down into, the epidermis and the dermis as well. And then this is a slowed down video. This is 1,000 times slowed down. And this is the TargetCool spraying solution directly into a gel-like skin matrix. and you will see that these channels start to form, kind of looking like eyelashes. And that is the solution continuously getting delivered down into that gel-like matrix. So this shows you that, you know, the power behind the TargetCool delivering solutions is there. Next slide, please. And then this is a comparison head-to-head showing a microneedling with hyaluronic acid. So you can see the solution delivery on the screen utilizing that function. And then on the right-hand side, the group 2, this is TargetCool with HA. So we're not, again, making any channels utilizing a microneedling pen or anything like that with the TargetCool. But you can see that solution delivery just from pushing it through with CO2, not even touching the patient's skin, is very comparable to the group 1 side of things as well. So I get a lot of questions like, is it truly delivering the solutions into the skin? And you can see the answer is yes. We're delivering it down, you know, into the dermal epidermal junction and beyond into the dermis. Next slide, please. And then this is fluorescence showing the hyaluronic acid and how much is getting absorbed into the skin. And you can see it's very comparable there to what microneedling can do. So why would you need to do microneedling when you can literally, you know, deliver solutions in a pain-free and needleless way utilizing the TargetCool? Next slide, please. Now I'm going to pass it over to Julie Gramick, our nurse, and she is going to dive into actually how to implement these 2 technologies into your practice, not only to give patients better results, but also at the same time show you how to build your business as well. Like how do we make profit doing this? How do we you know, increase revenue into your practice as well? So Julie, take it away.
Thanks, Chris. Yeah, so I was really impressed with the technology that you showed, the video of the channels being made just by the ice particles itself. So when I got a hold of this device a while ago now, it was to kind of check out the device and how the exosomes could be delivered into the skin. And I do appreciate that, Chris, because that got me my very first device, because I wouldn't give it back. I loved it so much. So why was it impactful to my business? Well, the number one reason is because we all know that microneedling is a time-consuming situation for your practice. You have to numb people. You have to have that room sitting for 30 to 45 minutes while they numb, and then another, you know, 30 to 45 minutes to do the treatment. Well, with this device, the number one change it made was how quick this device is. I did not need to numb them to do this ice needling. It was very comfortable, and it delivered the solution in those top layers of the skin, just like you saw with the microneedling. It got the product down where microneedling is traditionally meant to go in a pain-free, no downtime way. So it took, you know, anywhere between 10 to 15 minutes total in my practice to do this treatment. So it allowed me to do 4 times more treatments per, you know, based on the fact that the microneedling was taking an hour to an hour and a half. So that was the number one reason that I started making a significant difference in my income. My return on investment was so much better in this situation because of the time change or the time difference, the time savings that I had in my practice. And so that was number one for me, Chris, was the, you know, the amount of time that I saved. Number 2 was the pain that was significantly driving the microneedling business. People didn't want to come back for treatments number 2 and treatments number 3 and so on. So, you know, for patients to actually call me and say, oh my God, I need my next treatment, like, you know, like I was their drug dealer or something, was really valuable to me because it was like pulling teeth before, right? Microneedling, it had to be just right for the patient. It couldn't be around special events. It couldn't be around summertime, anything that distracted them from getting their treatments and following, a protocol that we set. So that was a significant change as well. It made me feel like they were staying engaged, right? The patients were telling me when they were ready, and it was always on time, or if not before. I was even expecting them to come back in. So changing my scheduling was a super significant role with this device, because it was keeping me busy all different months of the year, no matter if it was 2 days before a significant event for them or over the summer, because it doesn't cause the same type of reparative damage that we see with microneedling. There was no downtime. It was a game changer for my practice. How many devices can you actually say cause no downtime that have these significant changes? So I'm pretty impressed with just both of those in general. But now I'm going to show you a next slide, please. So before I got the TargetCool, it was very difficult to do some of these treatments because of time, or it just was too much effort to try to do them. So integrating this into my practice, like I said, standalone treatment sessions took only 10 to 15 minutes. Next slide, please. But this was the game changer for me. Immediate responses on the skin, no microneedling, no downtime. You can see the collagen and elastin. This was, one of our providers sending us this picture. This was 2 treatments with the TargetCool and 10 billion exosomes delivered without pain, without downtime. And you do see all of the collagen rebuild, all of the things that we saw with our exosome microneedling treatment results are being given to us without that downtime, no microneedling. Next slide, please. And then I got into something so special. So this was a personal adventure for me, a journey. I lost about 70% of my hair from COVID. This is not me. This is a patient of mine that I did a case study. But because I was looking for something to help my hair grow back and my patient's hair grow back, what a godsend this device was for me. Because again, microneedling of the hair was very time consuming. It was disgusting when you had to put numbing in their hair and then you had to clean it all out and hope that you got it all out. But this device, this treatment option, takes me less than 15 minutes to do. And this is a result after just 25 days from the first treatment to these results. You see in this picture all of the little baby hair, all of the, the change in that pigmentation, like Dr. Heika was talking about in his, microneedling with the exosomes. It was really giving an option that was pain-free, and patients loved it, and it was super quick to see these responses. Next slide, please.
That's been the difference that I've heard too in clinics as well, is that people that have had microneedling, in the scalp or whatnot, they're shocked by how effective that this is, but pain-free as well,
yes.
right?
Yes.
And
yes.
that's what providers are trying to find. How can I give, less painful options to my patients, but also get them results at the same time? So
absolutely. This gentleman, he's actually had multiple microneedling treatments with me, big radio frequency microneedlings, very uncomfortable. He would not stay on track with his schedule. But this was one treatment of the TargetCool device that is super easy to hold and use. One treatment and no microneedling, and look at those results. This is 30 days apart from the top picture to the bottom picture. There's some significant changes here that I like to point out. Number one is the support system around that hair follicle. It's having the hair come out straighter, more structured, more stout. It looks healthier. And like I said, this gentleman had had at least 6 to 7 microneedling treatment, radiofrequency microneedling treatments. And that was the best I could give him, was that top picture. That was about 6 months after his last microneedling treatment. This is just 30 days apart. So not only is it pain-free for those patients, but the difference in the delivery, in the overall outcomes, were significant changes. So I was able to do more of them in a shorter period of time, and then it saved me time, it saved them time, and it cost less. So it was pretty significant for this gentleman to see these results. Next slide, please. And then this gentleman, I didn't expect to see these results, to be honest. I was just actually hoping that I would get him some scalp health change. He has very traditional waxy, skin look from being bald for so long, and then the placard that's being built up on that scalp just because it's not in good condition. After one treatment, 30 days apart, all of that little baby hair where he hasn't had baby hair in a long, long time. Plus the placard's gone, the blood flow is better, the waxiness is gone. And this really does give him a better chance of having hair restoration, not only from the exosomes, right? We know that it does a good reset, but from this treatment and how easy it was, this gentleman has had some significant change. So in my practice, before I did the TargetCool with the Resilielle, I was trying to do hair treatments, but it was a gooey, dirty, long, messy process, and it took a lot of time and a significant amount of money, for these patients to pay, because of that time, because of the hour and a half that my treatment room was closed off for this numbing process and cleaning process, and then the treatment process. So that was a huge change for me, Chris, in just having the ability now to have a hair clinic. And I told you a million times, if I could go back 18 and a half years back and start my practice over again, I would start it with the TargetCool and Resilielle, because individually they're powerhouses. They're amazing treatment options, but together the synergistic effect of these two treatments are significantly better than the powerhouses of them, individually. So we've talked about, just the two types of treatments that I've done in these case studies, but Chris, this can be used in combination with, different laser treatments, different skin treatments, surgical intervention. Dr. Heiko was talking about scar prevention treatments. This is a hands-off way, pain-free way of applying the exosomes surgical intervention or different options. What are you seeing out in the industry, Chris, with other providers? What type of treatments are they using it with?
Yeah, this combination gives you so much to work with, right? When it comes to treatment options. I mean, hair is a huge focus right now. Everybody was so focused on facial aesthetics and then body aesthetics, but now hair is really taking, and scalp health is really taking, a forefront to the industry as well. I mean, some of these trade shows that we attend, AAD, things like that, the whole first day is dedicated to just hair and scalp now.
Yeah.
And you see the industry moving in that direction. But yes, post laser opportunities, microneedling, RF microneedling treatments, anything that's going to affect the skin. This is a great way to take down that inflammation immediately post procedure.
Yes.
But yes, all of these, pretty much any treatment option that you have within a clinic right now, this could fit into that and
Yeah.
make that even better and more efficacious for the patients. And I like to always say, if we could get great clinical outcomes and then mix that with business sense, where it makes sense for your practice and you can make money
Yes.
doing it, then you have a home run, right? And so I think that these two in combination are really, what will get you there.
Yeah. One
Maybe one more comment, if I can chip this in. I remember when you showed us this picture, and we were blown away by the efficacy of it, right?
yes, just
And
30
then
days apart, right? 30 days.
exactly.
Mhm.
So hands down, that was a better result than anything we had seen with microneedling. And
Yes.
I voiced my personal dislike about microneedling just because it seems so brutal and now it seems very unnecessary, right? And there's
Absolutely.
something else to be said. We had one patient, uh, we had like a provider using our exosomes and attempting hair restoration for a high-end client, and it failed after 2 attempts. And the high-end client was like not so happy. And we looked into it and got in touch. We got the provider in touch with Julie, and it turned out that his settings for the microneedling were just too radical. He wanted
Yes.
to, push it, and he actually inflicted some serious damage on the
Mhm.
patient. So he destroyed the hair follicles rather than helping them to reboot. And I
Yeah.
think that's a mission critical difference that cannot happen with a device like TargetCool.
Right.
And microneedling is just, I would consider it outdated. That's why I,
Yeah.
describe it as medieval, because the way it actually works is you inflict massive damage on your skin. You
Yes.
poke these needles into your skin like a sewing machine, and then the skin has nothing else but to restore, right? It has to regenerate. So the whole machinery of endogenous repair mechanisms is triggered, and that gives you an effect. And you can certainly boost that effect by the use of exosomes and can alleviate a lot of those uh, downside effects of microneedling. But if you have something like this at your disposal and this combination works just as well, if not better,
Right.
then I would question the validity of microneedling at all at this point.
Yeah, you're right, Dr. Hake, because I've been hearing there's a big buzz about using microneedling with acne. And oh my goodness, like I just think of it spreading the acne everywhere. But with this and with the Target Cool, with exosomes, treating acne now is super pain-free and effective because you're getting these exosomes to be able to go in and help support that reparative mechanism and helping those patients out. So I really feel, Chris, if we can go to the next slide, I want to show these are my results, my profit in my first year. And this is just something that if you guys can look at this return on investment, being not just a return on investment but a profit making process here. And I'm not all about gouging patients. I actually don't like that. This is actually reducing some pricing that I had to charge them before because the time in my room and the time and effort. But now $57,000 in just hair treatments, you know, alone in 1 year. That's pretty impressive. And if we can go to the next slide, $69,000 in facial treatments with the TargetCool and the exosomes. It's a significant change. Now we're talking about almost $150,000 in profit off of one device and one serum that is so effective on their own, but combined, it's just a great return on investment for this device and this product. I know, Chris, we put these numbers together and I was just shocked at what the difference was and the time frame in which I was able to make that kind of money was just pretty significant as well. Less work, less downtime for the patient, more comfort for the patient, and to be able to make more money in my practice was that's why I'm here, is to really showcase how I was able to bring this into my practice, change the way I did things for the comfort and the, less downtime for my patients. It was pretty significant.
And to be able to treat patients in 10 to 20 minutes
And
is amazing
yeah,
as well. So
thinking
they're
of their
more welcoming
time.
to come back, right?
Yeah, and think about their time too. I no longer have to, have them come in at the end of the day on a Friday because they have significant downtime for the weekend to be able to get back to work on Monday. It's a quick little lunchtime treatment with no downtime. It's pretty significant changes in the thought processes of what I used to do for my patients versus what I do for them now. So pretty significant. Tell us about the package deal that you have going on, Chris, because I think that they'll understand what I mean by return on investment with the package that you got.
Next slide, please.
There you go.
Yeah, so I spoke of a special promo that we have going on today. So, and first of all, I do see questions coming in, so we will get to those shortly here. But yeah, I wanted to go over what we have to offer here with this combination package. It's offered at $6,500. That comes with the device and enough consumables and exosomes to do at least 18 treatments, right? So if you just do those 18 treatments alone, you're looking at north of $7,500 to $8,000 of that you would make off of those treatment sales. So your initial purchase is more than paid for just off of utilizing the consumables that are included initially with the purchase. And we have a lot of providers that have paid off their entire purchase in as little as 6 weeks or less. So they're getting out there, they're doing great, drawing in new patients and being able to get them great treatments as well. And so we're going to leave this QR code up on the screen. Feel free to scan that if you're interested in getting either more information on the device or the RESILIÉLLE exosomes, or if you are interested in purchasing this combination package today. So we'll leave that screen up there while we dive in and get to some of the questions that have been answered in the question box. And first one I kind of noticed was it kind of directed at you, Julie. In your estimation and your practice, how has it been with being able to delegate these procedures to some of your other staff so that you don't have to take on as much, as well? You're able to, delegate some of these treatments to other people within your practice.
Absolutely. So this is super easy to learn, super effective to do, and easy to delegate. And something that Dr. Haga was talking about is some of these devices and more aggressive treatments. The providers really have to be, fully aware, very present to do some of those, other types of treatments. But this is so safe and effective to use on, any skin type, any skin tone. Both of these products can be used on any skin type and any skin tone in a safe and effective manner. So that is super helpful for practitioners that need to do some of those more aggressive treatments, and finding that time was always a challenge in my practice. So I had 2 estheticians that would use this device very effectively and get results, just as I would, because it's super, not foolproof, but super easy to do and get the same results over and over again. So it's super easy to delegate. Yeah.
And then we have a question for Dr. Haga. Can you please explain the long-term effect on a cell from lyophilized product?
Sure, yeah. So I mentioned earlier, it's like if you have a palliative or superficial treatment, or let's say like a growth factor. Growth factors are very popular. One of them is PDGF, and it's a great growth factor, very potent, very relevant, but it's only one growth factor out of roughly 50 there are. And then there's also around 250 cytokines and so on. So if you want to compare that, I mentioned earlier, is like tapping the doorbell, and briefly saying hello versus introducing like the complete cargo of an exosome and changing the cell from inside out. I once gave the analogy, if you compare a single growth factor, no matter which one it is, with the power of exosomes, you have to keep in mind that biology is very complex. In every cell, it's a constant, permanent interplay of roughly the expression of roughly 20,000 genes. They are all expressed in various levels at all times, and that is what a cell that makes healthy or sick. And like a growth factor, a single growth factor, or any palliative means of treatment, and an exosome, they don't even play in the same league. I once gave that analogy of, this is like comparing a Super Bowl winning NFL professional football team with a toddler throwing their first football in the backyard and daddy catches it. It's certainly very cute, and both will be on camera, I'm sure, but there's virtually no basis to even compare the two with each other.
Can you also chime in on, we had a question, are exosomes safe for pregnant women?
Yes, I would say so. So as a scientist or as a physician, you would always be, have a real reservation when it comes to pregnant women. So pregnant women should, generally speaking, never undergo anything that is not medically necessary. But we're talking about the safety profile of exosomes, and even in regenerative medicine, when you actually infuse or inject exosomes, they have no side effects being reported. Other like, actually, I cannot think of any at all. So it's supremely safe. And if we talk about a topical application of exosomes, I would have no reservations that being used on pregnant women as well.
Great to hear. Yeah, and then we had a question, what does it feel like? So I'll go ahead and kind of answer that a little bit. But with the TargetCool, so it's actually a completely enjoyable feeling sensation on the skin. It's cooling. We brought up the ice needling, but honestly, the patients, they may feel just like a slight tingle, if anything, but it's completely enjoyable for a patient. There's no pain, no downtime, anything from that side of things in regards to the TargetCool itself.
Yeah. And my patients say the same thing. It, especially if it's used after a big laser treatment, CO2, full ablative or partial ablative, fractional. It feels so comforting. The cooling is just so comforting after those big treatments. And even when I'm doing hair treatments, or I just did my skin about 30 minutes before we got started here with the TargetCool and exosomes, and it just feels so good. You do get that instant hydration, and then of course then the long-term effect will come, but it was so comforting. Like, I think the biggest thing for me is the turbulent air, right? That sometimes can cause a little bit of the breathiness, but it's very comfortable. It's very, very comfortable.
So
yeah, the power
speaking,
behind the device is really the key, right? And so it's really pressurized that's, coming out. So one thing I did want to touch on is these CO2 cartridges. So this is actually beyond medical grade CO2. This is actually food grade CO2. So you can rest assured that spraying around the eyes, the nose, the mouth, anything of a patient, it's completely safe in regards to that delivery as well.
Yeah. What were you going to say?
Scientifically speaking, for instance, if you compare that with microneedling is needles, right? It's a mechanical, physical damage you inflict on the skin. And those needles might look very small, but if you were to see them under a microscope, they would not look so small anymore and rather scary. With a device like the TargetCool, you have CO2 molecules that are like pressurized into your skin. So molecule size, fragments or something, or icicles, if you want, they cannot do any damage. And you have, as you both said, like you have this cooling effect and maybe a sensation from the pressure being applied, but there's virtually no damage done to those cells, and
Right.
you enable the exosomes to penetrate very deeply without all the pinpoint bleeding
Yeah,
that you've
no
seen.
disruption of that skin. Yeah.
Yeah.
Mhm.
We got asked, will we share this presentation? Yes, we will have this. We're recording it, so we'll be able to push that out to everyone to rewatch or share with other staff members as needed. Julie, maybe you can help with this one. There's a question about protocol. How many treatments are recommended? How often? What does that look like? So maybe you could touch on that, of how you kind of went about that.
Yeah, so just with any other modalities, I really do believe that it really is affected by the patient's age, the skin or hair issues, what's going on with the patient's health, to determine how many treatments you need. So I always start with, if it's a 30-year-old and it's a skin treatment, I'm going to do a set of 3. If it's 44, if it's 55, you get the point. So it's 1 per decade of life, is what I tell my patients. So that's where I start. That's the clinical starting point. And with the treatment sessions, I always do 30 days apart. Hair restoration is the same for me. I still want to hit it at the 30 days, but sometimes, they can't get back in for 6 weeks, and that's okay too. So it's not like you can't wait an extended period of time to get them in. But I really do believe, and we all know this is so taboo to say, but I do believe that there is a series of treatments that are necessary to do to reach the goals of the patients and to achieve those goals for them. So it's not a one and done. It never will be. There isn't a magic cause and effect here. It's true science working together to create the results that you're looking for, whether it's be hair, skin, acne, rosacea, pigmentation, whatever. There isn't a magic bullet, but this really does do a better job. Like Dr. Hake is saying, if you're not injuring the skin, you have a quick healing time. You can get right back at it. I've even done acne every 2 weeks instead of every 4. And so I really do believe that the protocols set here are just up to you as the provider and the patient's needs. That's the best I can say, but we do give you, on both company sides, we do give you protocols that can be effective to start. And then the clinical judgment that you have to elevate the treatment, do it more often, do more exosomes, whatever is necessary to get the results for the patients.
So would you say, in terms of protocol, that you have kind of a treatment zone and then a maintenance zone after that, to where we maintain the, okay.
Yeah, there's always maintenance. Yeah, go ahead, Doctor.
I never disagree with Julie, but I consider exosomes, and especially, with that delivery, as close to a magic bullet as you will ever get.
But yes, I agree.
Everything we treat is actually age-related, and aging will, be persistent. So that's something we cannot prevent. We can rejuvenate, obviously. We can turn back the clock a little bit, but once we turn it back, it keeps clocking. So it keeps ticking. So as Chris said, it's like a package of age-related suggestions, how many sessions you might have in a relatively short order, and after that is maintenance to actually, Also interesting, our skin trial, we noted that younger patients have a greater effect by tendency than elderly patients. And it kind of makes sense if you think about it, because if you have a 30-year-old and they undergo 3 treatments, all of them had like 3 treatments and then have them report. And you shave off the clock maybe like 2 or 3 years, then a 30-year-old goes back to a 20-year-old. And that is like a noticeable difference. If you're like in your 60s and you do 3 treatments, then you're back in your like mid 50s, and you might not see like such an overwhelming effect. So hence Julie's suggestion, per decade add like an extra treatment in the initial package, and that should set you up nicely. And then of course there's individual response, how well you respond to the treatments, and personal desires, how far you want to push it and how often you want to do it.
Right, right. Yes.
Yeah, we have another one. I'm not sure on this one. So, did you try to check exosome delivery through transepidermal delivery, like the TED from Alma?
So I do know of a couple of practices that are using the exosome treatment after the TED and having great results because hands down, the exosomes, have the ability to reset and rejuvenate cells better than, just any energy-based device, because it's that reparative mechanism. It's causing an injury for repair. With the exosomes, they come in with the message to repair and with all of the tools to repair those cells. So it is resetting and doing a better job than a single treatment on its own. Wouldn't you agree, Dr. Heika?
Absolutely, yeah. Any modality really is amicable towards like adding on exosomes, right? It makes sense. I know like it sounds like I came down pretty hard on microneedling and so on, but some people do it for a while, forever, and they like the microneedling and believe in it and they want to continue to do so. And then please feel free to do so. And other modalities have great effects too, because you typically initiate a skin remodeling already by any kind of modality. And then the exosomes can boost it, to like an unknown level really. But even if you do under other modalities, you could still use the TargetCool to just superficially apply the exosomes after such a treatment, because it's easy to spray on, and you will further support the penetration of it, and then you have like a winning combination of like three modalities. So
Right.
the sky is really the limit, and it's often a matter of personal requests or desires by the patient, or what practitioners might suggest for a given indication could be the best. But
Yep.
always add it on, and the delivery system is second to none.
Yeah. So easy. Mm-hmm.
Yeah, the last couple questions are just more around before and after photos from like acne or hyperpigmentation, and then if it's been tested on hands.
So it has been tested on hands. The exosomes and microneedling has been tested on hands. So of course I had to take it and test it on hands for myself. And I actually do. I will get some before and after pictures. I did one side with for a couple of treatments and one side without, and the change in pigmentation alone was pretty significant. So we know that the exosomes do an amazing job at reducing that pigmentation and also supporting a suppression of pigmentation. So it's yes is the answer on the hands. We do have before and after pictures for the exosomes in the clinical study. All of those results that Dr. Heika shared, we do have some before and after pictures that we can definitely share and provide to you. It's pretty impressive to see.
I should have included one that we have also from one of our company associates, the wife of our chairman. She's 70s and she was always somewhat unhappy with her hands, that they look old. And we have before and after picture. So her skin really looks waxy, like parchment almost. And after one session of microneedling plus exosomes, you see like it looks more vital, more rosy. Elastin and collagen are fully back on track and so on. It's remarkable difference. I unfortunately didn't include it in the presentation, but I can send it to Chris, and then you can reach out to him for these kinds of before and after pictures that we're always happy to provide.
Yeah,
if you have further questions, because we want to wrap up, we don't want to take too much more time for everybody, but feel free to scan that QR code. Within there, you'll be able to ask questions and send that directly to us so we can respond also. So feel free to send your questions through there. But yeah, we're going to go ahead and wrap up. I really appreciate you guys attending. Hopefully it was very educational, very helpful for you. Hope you will bring on the TargetCool and RESILIÉLLE exosomes into your practice. Dr. Heika, thank you very much for all your help in attending this, and same to you, Julie. Thank you again for all your help as well. yeah, we're going to go ahead and end the webinar. So please feel free, one last time, if you want to scan that QR code, go for it and send us any questions that you have, or if you would like to go ahead and order, please do so as well. Thank you for your time. Appreciate it.
Bye, everybody.
Bye.